Simplified summary, polymyxins. Common drugs. Colistin, also called polymyxin A. Polymyxin B. Mechanism of action. These are cationic, positively charged, polypeptides. They bind to phospholipids in the cell membrane of gram-negative bacteria. This disrupts the membrane, causing leakage of cell contents. Rightward arrow leads to cell death. Clinical use. Used as last resort, salvage, therapy for multi-drug resistant gram-negative bacteria, such as Pseudomonas aeruginosa, E. coli, Klebsiella pneumoniae. Polymyxin B is also found in topical ointments for skin infections, like triple antibiotic ointments. Side effects. Nephrotoxicity, kidney damage. Neurotoxicity, slurred speech, weakness, tingling or numbness. Respiratory failure, due to neuromuscular effects. USMLE Question 1, Mechanism and Bacterial Target. A 70-year-old man with a ventilator-associated pneumonia caused by a multi-drug resistant Pseudomonas aeruginosa is treated with colistin. What is the most likely mechanism of action of this antibiotic? A. Inhibits cell wall synthesis. B. Disrupts DNA replication. C. Inhibits protein synthesis by binding to the 30s subunit. D. Binds phospholipids and disrupts bacterial cell membranes. E. Inhibits folic acid synthesis. Correct answer, D. Binds phospholipids and disrupts bacterial cell membranes. Explanation. A. Cell wall synthesis inhibitors, like penicillins and cephalosporins, not polymyxins. B. DNA replication, fluoroquinolones, not polymyxins, target this. C. 30s inhibitors, tetracyclines and aminoglycosides use this mechanism. D. Correct. Polymyxins bind bacterial membranes and cause leakage and cell death. E. Folic acid synthesis, trimethoprim and sulfonamides. USMLE Question 2, Clinical use and toxicity. A patient with multi-drug resistant Klebsiella pneumoniae is started on colistin. 2 days later, he develops numbness and weakness in his limbs and shows signs of acute kidney injury. Which of the following best explains these findings? A. Allergic reaction. B. Immune complex deposition. C. Direct toxic effects on neurons and renal tubules. D. Drug-induced hemolysis. E. Autoimmune vasculitis. Correct answer, C. Direct toxic effects on neurons and renal tubules. Explanation. A. Allergic reaction would cause rash, eosinophilia, or anaphylaxis, not these symptoms. B. Immune complex, associated with glomerulonephritis, not neurotoxicity. C. Correct. Polymyxins are directly toxic to both kidneys and nerves, causing nephrotoxicity and neurotoxicity. D. Hemolysis, not a known effect of polymyxins. E. Autoimmune vasculitis, would involve other systemic findings and serologic markers.